Hello and welcome everyone to this very special awareness webinar presented by Hindustan Times in association with Roche Diabetes Care India Private Limited. Today's discussion focuses on a theme that lies at the heart of effective diabetes care: sugar monitoring at home for effective diabetes management. With diabetes affecting millions of Indians today, understanding how to monitor blood glucose at home and manage it confidently has become very, very important. We have brought together an esteemed panel that brings expertise, experience, and real life perspectives to this conversation. So, without much ado, let me start by introducing our esteemed panelists. Joining us first is Dr. Rajiv Kovil, Medical Director and Consultant Diabetologist at Kovil's Diabetes Care Center and a leading name in diabetes management in India. A gold medalist in diabetology and consultant at several reputed Mumbai hospitals, Dr. Kovil has been instrumental in shaping diabetes education and patient care across the country. We are also joined by Mr. Ankit Shah, CEO of the spice brand Kusum Masala. Mr. Shah has been living with type 2 diabetes for over 23 years, and after facing several challenges early on, he has successfully turned his journey around with consistent self monitoring and holistic management, and is now completely off insulin. Representing Roche Diabetes India Private Limited, we have Dr. Sandeep Sewlikar, Head of Medical Scientific Regulatory Affairs and Quality for Roche Diagnostics India and neighboring markets. With over 25 years of experience across academia, pharmaceuticals, and diagnostics, Dr. Sewlikar is passionate about digital health, preventive care, and precision diagnostics. Thank you all for joining us today. Together, we will be exploring how self monitoring of blood glucose or SMBG can make a tangible difference in managing diabetes at home, and how technology is making that journey easier and more empowering. So, without much ado, let's get started. My very first question is to Dr. Rajiv. Um, Very, very basic question. We all know, and everybody does it all the time, that is to check blood glucose regularly. But not many of us know why. Why do we need to do it regularly? And of course, what are the risks if we don't do it regularly?
Thank you, Hindustan Times, for having me here. Type 2 diabetes is actually a clustering of a lot of metabolic issues. And the reflection of all these issues is the blood glucose. And testing blood glucose is akin to a child doing homework at home. If a child doesn't do homework at home, you don't expect him to get distinction at exams. So similarly, the basic responsibility of a person with diabetes is to measure and monitor, and we have to also look for surveillance of any other complications. But the responsibility to measure and monitor is the responsibility of the person with diabetes, and this is something that he needs to do on a regular basis, because as I said earlier, the diabetes, type 2 diabetes, is a cluster of a lot of metabolic disorders, and we need to do a lot of screening checks to prevent complications. And is actually self-monitoring of blood glucose is one of the first and earliest steps to prevent complications of diabetes. And diabetes by itself can have devastating complications. So diabetes is not just a blood sugar disorder, it's a vascular disorder. When I say it's a vascular disorder, I mean that it affects the blood circulation across the body. So whether it's the heart, whether it's the kidney, whether it's the legs, whether it's the brain, every organ can get affected because of diabetes. Broadly, we classify complications into microvascular and macrovascular. But the time has come, a lot of newer complications have also got added to diabetes. Like mental health issues have got added, heart failure has got added, dementia has got added. So apart from the classical complications of heart disease, kidney disease, eye problems, foot problems, liver problems, a lot new disorders and complications have been added to the list of type 2 diabetes. Hence, monitoring of sugars, and monitoring and prevention of complication is the mantra for every person living with diabetes globally, I would say.
Very, very well explained, Dr. Rajiv. I like the analogy of a kid doing his or her homework well to get flying colors in examination. And that is pretty much how we should be living and taking care of our lives and getting ourselves monitored regularly. Then it kind of leads to my next question that when should a person ideally test? Fasting after meals, bedtime, or what should they expect as a healthy range? If you could explain this in simple words for our
So,
audience.
so, so that's a very good question, because a lot of people believe that the pricking at home is just a replacement to going to the lab, and it needs to be understood by the doctor and the person with diabetes that by doing the self monitoring of blood glucose, we are actually trying to see a pattern or understand the pattern of a patient. So it has to be done in a very structured way. It cannot be done haphazard. So structured SMBG is crucial for the patient to understand his variation and the doctor to help him in getting through the variations as such. So it's ideally pre-meal, which we have 3 meals, and bedtime is the first that we recommend. And any pre-meal blood sugar should be between 80 to 130. Um, Post meal is 2 hours after starting of the meal, which should be less than 180. Before we only recommend first pre meals to be done. Once our pre meals are better, then we would also recommend a post meal to be done. Depending upon what the therapy the patient is on, it could be three times a day, sometimes 4 times a day, sometimes once a day. It all depends what type of medication the patient is on, and we have come up with guidelines suggesting that what the patient's therapy is. Based on that, the structured monitoring should be so and so. So I think it's very crystal clear on how the monitoring should be, and that is very important that we educate our people with diabetes that how to use the glucose meter very effectively and in a structured manner, so that we can help and prevent outcomes as such.
Right, right. If I were to take your analogy of the homework a little further, to me it sounds like even having a timetable in place
Absolutely.
for doing these tests regularly for
Absolutely.
your own self, and this
A-
timetable is as per your requirements. Um,
Absolutely.
yeah.
So the timetable for algebra could be lesser and probably science could be more. So depending upon what therapy you are on, you need to make sure that the SMBG is then kind of changed based on the therapy that the person is on.
Right, right, right. We'll come back to you, Dr. Rajiv. I want to bring Mr. Ankit on board. Mr. Ankit, very inspiring to begin with, I must say, very, very inspiring. You've been managing diabetes at home. Could you share how home monitoring, in particular, has changed your approach? Were there any challenges, if at all, and how did you overcome them?
Thank you for having me today, Shivani and Hindustan Times. Um, to answer your question, there were a lot of challenges earlier on. The first and the largest challenge was the acceptance, because the moment you realize you're diagnosed with diabetes, the first step is denial, and you have to overcome that. The moment there is acceptance, then the therapy starts. And I believe with a good doctor and a good team, I think managing diabetes is not as difficult as it initially seems. um, to look at the blood sugar monitoring at home, I believe in the journey of diabetes management, that is your eyes and ears. Until you do not have the data of what you're doing, how you're micromanaging the diabetes on an everyday basis, the longer term solutions like HbA1c, which is a 3-month average sugar monitoring, and all of that comes later. But for you to realize yourself, for example, there's a wedding in the family, you've had some heavy food, sweets, whatever, and then you come home and check the sugar. It gives you a sense of how your sugars are reacting by eating what, and all of that. I believe that doctors can help you to a certain stage, but beyond that, you having to work on your diabetes is equally important. I think that is where this blood sugar monitoring and other monitoring aspects come into play. Apart from visiting the doctor regularly, conducting some tests, maybe checking your foot and checking your eyes and all of that once in a year, like Dr. Kovil recommends us and all of that. But yeah, so that's my take on diabetes. But from a journey of over 23 years, from taking over 30 units of insulin thrice a day and today completely off it, I believe it is manageable. It is not as bad as it seems if the intent is correct, if the guidance is correct. And I believe with the right lifestyle, with right exercise, with right attitude, you can overcome diabetes and manage it well.
Very
Right,
well said.
right.
Thank
Very,
you.
very inspiring, Mr. Ankit. Our audience are very thrilled to have you. And to me, it also sounds as if, timetable, but I think we should maintain an Excel sheet, a spreadsheet, kind of a digital tool which will allow you to kind of monitor it over long term. And the other thing which I kind of understood from your story is that you have to be proactive, because at the end of the day, you are suffering. And rather than the disease uh, controlling you, you are two steps ahead if you are in controlling it. So that is what I could understand. Moving forward, Dr. Sandeep, uh, can you explain what self-monitoring of blood glucose really means, and how digital tools like connected glucometers with app can make it easier for patients?
Thank you, Shivani, and thank you, Hindustan Times, for having me here. And I think I think really said the information right. I think Dr. Rajiv clearly highlighted the progression of disease, the challenges that we face as if we don't control in a recommended way. And I think Mr. Ankit that really clearly shows like how it is equally important for us to really control not only from a doctor but also a individual, any critical role individual has to play. So I think Dr. Kovil really mentioned about SMBG, that is self-monitoring blood glucose. Actually it's a clinical term for the practice where the individual diabetes patients with diabetes use personal glucose meter to measure their own blood sugar levels at home. It is clearly recommended by all major global and Indian guidelines like American Diabetes Association or RSSDI here in India. It's actually a very core component of diabetes care. And it's actually a fundamental principle is to provide immediate actionable feedback on the direct impact of your diet, physical activity, and medication. Dr. Kovil clearly mentioned what those time points basis the progression of disease, whether it's 3 point or 4 point, 5 point. I think basis all the data that is coming from SMBG, that is self-monitoring blood glucose. Now, coming to your second point, like digital tools, actually, it's really completely revolutionized how we perform self-monitoring blood glucose. Historically, if you see, like we have involved like meter and manual logbook. That is no longer the case with all digital tools available with us. And with this ecosystem, meaning I think the Bluetooth enabled glucometers and the mobile phone app have overcome all the major limitations that we observed during old method. So what exactly that benefiting us? That the first point is through this automated system, we could able to accurately capture the data. And I think Dr. Kovil clearly highlighted why this data is very critical to really give the right treatment approach or treatment to the patient. So when we check sugar, reading can be instantly and wirelessly sent to the app, and that could be seamlessly shared with the doctor. Potentially, it really overcome the challenges of error in manual logging that we used to face earlier. And the second most important, I think, how now we are into digital world. AI is really the talk of the town. It really helps transforming the data into the insights. When we gather the data as recommended by the physician, it gives you a visual reports, train graphs, because that's equally important how the blood sugar levels are changing over the period of time, like during the day. As Dr. Coyle really mentioned about three meal approach, right? So I think that really gives you information about any consistent spike in glucose in an at particular certain time of the day or week or so. Actually, it gives you a more information about what whether the reading is going above or below that the target range set by your doctor, and that's the instant clarity given to the patient as well as to the patient. And third, I think last point I want to share, it really enhances the doctor patient conversation, because this is a critical advantage, right? So patient can easily share the data with their treating physician through the app. Doctor can easily access what's the real-time glucose data through very cloud-based dashboards, and making consideration more focused, informed, and collaborative. So I think in summary, definitely the digital tools transforming the SMBG, the way that we earlier used to treat earlier, but in a more powerful and meaningful way by integrating system with the for the managing of diabetes. Definitely, it increases your engagement, provides superior data quality, and collaborative relationship with your doctor. I think, and doctor really get this data in a real time and then put the right treatment approach for the patient. But it's all about is how best you can improve the health outcomes and patient adherence to the compliance to the measurement of blood glucose as well as for the treatment.
Thank you, Dr. Sandeep. We say information is power. After listening to you, data is power. And in the diabetes management situation, I would say apart from medication, data is going. It will be the life-changing, ingredient in that. We are coming close to the end of this discussion, but all of you, I would like to hear one final thought from each one of you, and please be as elaborate as possible. Share your thoughts for our audience. Starting with you, Dr. Rajiv, please.
I think that it's very important that we have a very cultural change towards diabetes, and that can happen only when we make the healthy foods cheaper. We put extra tax on unhealthy food. We teach nutrition to kids in school. We prohibit. We put warnings like we have on cigarette packs for unhealthy food. We get a cultural change among all of us, because diabetes is just tip of the iceberg, because you have a lot of NCDs which go along with diabetes. That's why I said it's a metabolic cluster of disorders. So we need to get a cultural change in India where eating right, exercising right, exercise as a part of tradition should be imbibed in our culture. Then only we can make a change in outcomes, because today what is happening is that we are trying to treat complications, but we need to be primordial. We need to prevent these complications, and we need to this can be started only when we teach young children, young kids, the importance of nutrition and exercise, and the right behavior, right attitude, and right eating habits. And I think that is the change that I would like to see in India.
Very, very well said, Dr. Rajiv. I think awareness, starting young, ability to read labels, understanding labels, I think has to start very, very early on, very bang on about that. Mr. Amit Shah, please, if you have something to say.
Yes, I
Ankit.
fully. Yes, Ankit. Never mind. I fully agree with Dr. Rajiv Kovil. I think the whole cultural shift in India is very, very important. We are the diabetes capital of the world, and we need to start acting like one, because it's not something that we are proud about, but we need to control it. Now is the time to start. For people who do not have diabetes yet, should work on maintaining a healthy lifestyle, because the threat is imminent, right? And for people with diabetes diagnosed already, I think we have the right tools, as Dr. Sewlikar also pointed out. Now, with modern tools available, Bluetooth enabled, and all of it, I think it's sacrosanct to be in par with today's technology, being in constant touch with your doctor. And as you said, the entire lifestyle, there is no option but to maintain a healthy lifestyle. And once you start doing that, you will thank that apart from any other disease, you have got diabetes. So I look at it very positively. Right from the shift when I got it, I was thinking, why did I get the diabetes? Today I'm saying, thank God I got diabetes and not any other complications. So I think that is something beneficial with diabetes if you're able to manage it well. And today's pharma companies, today's doctors are competent enough to help you manage that. So I think it's something you should work towards, and everybody should work towards, as Dr. Rajiv Kovil said. I fully agree with him.
Thank
Yes.
you.
I think the next time, when our pays rise or we get a bonus and we think of investing in a gadget, I think it could be this Diwali in a home care diabetes management tool. That will be a very good, healthy investment in ourselves, I think so. Dr. Sandeep Sewlikar, please, last words from you.
Yeah, thank you. And I totally agree with Dr. Kovil and Mr. Ankit. I think it's time to really change the total shift in the cultural mindset as well as adopt the tools that available, like digital tools available for us. All towards, I think, how we can simplify monitoring so that people can focus on living their lives and not just managing their diabetes. And I think Mr. Ankit shared his journey. I think that's really inspiring. And as we discussed, SMBG, that is self-monitoring blood glucose, is vital part of diabetes care. And the digital tools like Bluetooth-enabled glucometers paired with mobile apps, it's really made it more accurate, insightful, and user-friendly than ever before. Really help, I think. It really improves patient management and empowers data-driven conversations with doctor. Ultimately, I think these solutions support better diabetes management and better outcomes. So just to end it with, I think it's about giving you the right tools to take control of your health journey and that with confidence.
Thank you. Thank you, all of you, for sharing your experiences and expertise. I have learned a lot today and very inspired by all of your whatever you have to share. And I'm sure the audience will feel the same way. And to our viewers, remember, diabetes management starts at home with you. With the right knowledge and right tools, digital tools especially, in consultation with your doctor and lifestyle modifications, you can stay in range. So stay informed and stay healthy. See you again next time.